Canada. What kind of doctor? So I practice functional medicine. Functional medicine is all about getting to the root cause and figuring out what the really why the body is having these issues. Whether it's a thyroid issue, and then people go, "Oh, you have Hashimoto's," but what does Hashimoto's actually mean? Well, it's an autoimmune disease, but why does the body attack itself? And so that's the big thing that I'm looking at is the underlying root cause. I've been doing this for over 20 years. My F8 doctors, our offices, F8 Well Centers, we have them in Colorado and in Tennessee, and we work with patients all over the country, even up in Canada, and so we have over 100 years of. Oh, we're glitching a little bit here. Let me do this. Reset that one. Okay. I think we're glitching. Is that lost connection? Yeah. Let's go here. See if that works. Yeah, let me know. Let me know if that's working better. So again, welcome guys. Put your questions down below. Love seeing this. So family ties. I'm dealing with muscle twitching. My labs are normal, but muscles are still twitching. Please help. Yeah, absolutely. So when we start thinking about muscle twitching, we are thinking there's got to be some type of an electrolyte issue. Hey Jared, good to see you. There's got to be some type of an electrolyte issue, some type of problem where the muscles are not getting those nutrients like they need to. Let me see here if we can reset this one. Hold on a second, everybody. We're having some technical difficulties, and I might have to restart this one. Yeah, it's glitching. So yeah, everybody in the Facebook and YouTube world, I'm not sure what happened. That one was glitching. Let's start over. All right, so we're back. Hopefully that is working. Everybody else jumping on in the TikTok world, great. Come back on and we'll go from there. So Ruth, what makes your eyeballs ache? So it depends on the aching. If they are like pushing out and if you're actually seeing the eyeballs bulging out a little bit, then that is going to be a potential for a hyperthyroid state like a Graves' disease. So you need to look into if you're actually seeing the eyeballs pushing out and that pressure, you may be getting some type of a hyperthyroid state in there. So again, pop down below where you guys are watching from. Patricia, good to see you. Ruth and Jerry, getting tired after eating causes. So this is my girl 92414. Tired after eating. Usually a blood sugar issue. It could be that that blood sugar is spiking up and then crashing down. And so what we're looking at is blood sugar goes up quickly, the body pulls it down quickly, and when we get that hypoglycemic, we can feel tired. Some people actually feel tired from a high one. Hey, Miss Tayo from Canada, good to see you. So again, if you can keep that blood sugar as steady as possible, you'll see some massive changes there. My TPO is 708. I was diagnosed with Hashimoto's yesterday. Can you explain what diet I need to eat? Yes. So TPO means that you're attacking your thyroid, you're destroying thyroid tissue, and now here's the difference. Good to see you, Monica. I'll get to your question in a second. Good. Here's the difference. It's not a thyroid disease now. It's an autoimmune disease, and your body's attacking its own tissue. Marion, good to see you in Sioux City. Hey, Paula. So you're attacking your own thyroid, TPO. TG, thyroglobulin, means you're attacking the bus that's transporting it around the body, but you are attacking your own thyroid tissue. And now you need to think about exactly what you're saying, diet, because that's going to be a huge part of what is driving this autoimmune. Number one thing you can do is take out gluten. People that have Hashimoto's, it's usually the body is attacking gluten, but then also attacking the thyroid. So every time you eat gluten, it can trigger the attack of the thyroid for up to 6 months. So we can see that so many times. Again, pop your questions down below. So get gluten off, but then also for autoimmune, you need to stabilize that blood sugar. 85 to 110 all day, every time the blood sugar spikes up, every time it crashes down, it revs up that immune response and it destroys more tissue. So we've got to get that stabilized in there. Great question. Brittany, if you want to give Ash some of our video links for YouTube. I've got over 700 videos. Educate yourself, learn on YouTube. You can just Google, search that and see, just search Hashimoto's, autoimmune, all of those different things. So we've got Marion, my 9-year-old has stopped sleeping in her own bed. She said she doesn't like being alone. What can we do? So Monica, I would look at hard time getting to sleep or hard time staying asleep. If it's hard time getting to sleep, then you really want to focus on that sleep hygiene and turn the lights down low, have lavender going, give her a bath before bed, really dark curtains, maybe just a little salt lamp in there, that reddish orangish light. It's winter, so you can sit by the fire before bed and just get her to relax as much as possible. If she's waking up in the middle of the night, it's probably a blood sugar thing. So you're going to have to get her blood sugar stabilized, and that can really affect it. So if any of you guys are having blood sugar issues where that blood sugar is crashing down in the middle of the night, you will be waking up and your mind's going to be racing. You're going to be going into this kind of heart racing. You could be sweating, a lot of different things. Give me a heart, give me a thumbs up if any of you guys have a hard time getting back to sleep. And that is usually a blood sugar thing. So again, pop down below where you guys are watching from. I'll give you a shout out. Put your question down there. We usually get hundreds of questions on these. I don't get through everybody's, but if I don't get through yours, send me an email, drben, D-R-B-E-N, at f8wellcenters.com, and I'll answer your question that way. Otherwise, you can get a hold of us if you want to schedule a discovery call. We work with patients all over the country, or you can come into the Colorado or Tennessee offices, and there's a link down below in our link tree, and you can click on that one. And if you have not followed our page yet, go ahead and do that. We have tons of information. I go live all the time. Do the adrenals cause hypoglycemia? So the adrenals may not cause them, but they're going to be intimately related. So think about this. Every time the blood sugar starts going down low, and especially a fast low, then the adrenals are stimulated to tell the liver to kick out glucose. So every time that blood sugar starts going down too much, if you had a big spike and then you're crashing down, or if you didn't eat enough fat or protein and it's starting to go down, then the adrenals are going to kick in. So if you already have adrenal fatigue and the adrenals aren't able to tell the liver what to do and your blood sugar starts going down, then absolutely the adrenals can contribute to it because they're not going to be kicking in enough to bring glucose out of the liver. So if you are having hypoglycemia, they call it reactive, and it can be from that blood sugar drop can be from the adrenals being fatigued, but also the number one stressor to the adrenals is actually blood sugar swings, and especially the lows. So we see it all the time that there is an intimate connection there. Jennifer, good to see you in Arizona. Don, dental work, will it affect the gut? Will puffy gums kick in the immune system? Yes. So yes. The mouth, the teeth is going to be one of the most important places. You need to be flossing, literally flossing every day or two. And what that does is it's going to actually help your heart health. If you've got bad bacteria, infections in your mouth, you can cavitations, which is actually where they didn't really clean out the spot. If you had a tooth pulled or anything like that, and you've got a cavitation, it may drain down into your lymph system and cause some more things. So yes, mouth hygiene, mouth health, and gums and teeth, very, very important. So Shannon, good to see you. Hello, had total thyroidectomy in November. Is there any correlation with severe Charlie horse cramps now? So possibly, it's a big thing that you're trying to do still from November. Thyroidectomy means take the thyroid totally out. And so what that's doing is now you're trying to regulate your body's thyroid hormones with an external thyroid. So you're probably taking levothyroxine, which is T4, and so the big thing that we're looking at, first place to start with Charlie horses is electrolytes. So Celtic sea salt is a great one. Give me a thumbs up if anybody has used the Celtic sea salt. You can get that on Amazon, Sprouts, any of those places, and so check that out. And so you need to figure out what dosage is going to be best for you. You may need more, you may need less, you may need to try a natural form like Armour, Nature-Throid, something like that. But you just have to keep trying different thyroid medications. So yes, it definitely could be that. Elizabeth, fatigue, sore throat going on. Couple things, Elizabeth. I would, if you're just feeling run down and you're getting a little cold or flu, bumping up your vitamin D. We'll have our patients do 50,000 IU for 3 days. 50,000 a day for 3 days, and then go back to their normal vitamin D level. You can up your vitamin C, zinc, things like that, and that can definitely make a difference there. So yeah, try that one out. If it's a long-term thing, if you're tired and sore and achy all the time, in your blood work, look at your white blood cell count, WBC. So if you have your blood work, get it out. And if it's under 5, that's usually a chronic infection. And if there's lymphocytes, which are our viral markers, if those are over 38, you have a chronic viral infection, probably Epstein-Barr virus. So you need to figure that out and get that cranking. Blue Sky 56, anything I can ask my endocrinologist today? Absolutely. Here's the deal. I always say the worst job in the world would be an endocrinologist, because you're going to go in, you're on medication, your numbers probably look okay in their range, and they're going to say, oh, everything's fine. And you're going to say, I feel like crap. Or you're going to go in and say, I feel good, but then they're going to jack with your ranges, or your numbers, because your range is out of where they want it to be. So what you want to do, write these numbers down, Blue Sky 56. This is what you want to get done in your thyroid blood work. You want to run your TSH. Remember, TSH is not a thyroid hormone. It's a pituitary hormone telling the thyroid what to do. Thyroid stimulating hormone. You also need to run your T3 and T4 free and total. So you're going to run 4 T3s and T4s. And then you're going to run your reverse T3, which tells us about estrogen and some different things. And then you're going to also run your TPO and your TG antibodies, so your 2 Hashimoto's markers. If you do not have all those run, you're not getting the whole picture. If you don't know if you have Hashimoto's, you have to run those autoimmune markers. And if they say it doesn't matter, find a different doctor or insist on it. It's like $15 if we run through our labs to run that. So again, welcome everybody that's jumping on. Dr. Ben Galliard, F8 Well Centers. We have offices in Colorado, in Tennessee, and my F8 doctors, we've got over 100 years of experience between us. We work with patients all over the country. If you want answers, if you want solutions, whether it's thyroid, digestion, any type of brain issue, whatever you have, click that link down below, schedule that discovery call, and we will get you guys cranking on going down that path of getting your health back. So family ties, my muscles keep twitching, but my labs are showing normal. Sending a message from South Carolina. Yeah, so again, send me if I don't get to your question, send me an email, drben@f8wellcenters.com, DRBEN. Muscles keep twitching, my labs are showing normal. It could be iron. You could have low ferritin. If they're not checking your ferritin, it could be from that. It could be electrolytes. We have to look at sodium, potassium, some things like that. All right. Is that processed sugar or things like honey too? So Millie is asking about blood sugar swings. So here's the deal. I want your blood sugar 85 to 110. Brittany, you want to put a link for my blood sugar book? I've got blood sugar book on Amazon. You can grab Blood Sugar Doesn't Lie. And we've been checking blood sugar for years on people. Even before you could get CGMs, we were having people finger prick glucose monitor test. Now we have a continuous glucose monitor where we're able to see on a regular basis, what is that blood sugar doing? What is it doing? What is it doing? What is it doing? And we're able to see all the time. Does that blood sugar go up too high, down too low, 24/7? You put the patch on the back of your arm or on your abdomen, and you're able to figure out exactly what's making it go up too high or what's making it go down too low. So processed sugar, absolutely. Honey, probably, but also it could be quinoa, it could be rice. Almost every single patient we've ever worked with, rice makes them go through the moon. They can't have that blood sugar. So you know, it is really, really important that that blood sugar gets stabilized. However, you need to do it. So when we start tracking our patients' blood sugar, we're able to see amazing results because they're able to keep that as steady as possible. Bussy F. My vitamin D is at 30 and my white blood cell count has gone from 6.9 to 10.4 in 3 months. Doc says it looks good. So vitamin D, this is a perfect example, guys, of why you need to have us run your blood work, because your doctor is not looking at the right ranges. Your lab will say 30 to 100, 30 to 110, 30 to 90, something like that. And anything under 30 is bad, is low, but 30 and above is good. So think about this, 29 is bad, so 30 is good. I want your vitamin D 60 to 80. If you have an autoimmune condition, it needs to be upwards of 80 to 90, and you're down at 30, and the doctor's saying it's okay. So you absolutely 100% need to be taking vitamin D, however much it's gonna take you to get up to that 60 to 80 range. But your white blood cell count, if it's over 8, your WBC, you are in an acute infection. So you're fighting something off. Guaranteed 10.4 is high. Your body is fighting something off. You're inflamed. You're probably dealing with some type of a gut infection, some different things in there. So yeah, you need a second opinion. Click that link down below and let's schedule a call on that one. Let's see what else we've got here. Nicole, great to see you in Massachusetts there. Tierney DeForest, thoughts on 1 round of HCG shots to reset metabolism. You know, HCG, that's the pregnancy hormone. This was popular probably 5, 6, 7 years ago. And, you know, people lost weight. They would do the HCG diet. It would be like 500, 600 calories a day. They would do the HCG shots and lose a significant amount of weight. I never saw somebody maintain that weight loss, even if they went back to eating a healthy diet or, you know, not eating too much, but adding back in foods. I never saw somebody do it. So I would not recommend the HCG shots or the diet as a long-term solution. If you're like, I'm getting married and I got to lose 30 pounds and I don't care about my health or anything else, and you just want to lose weight, sure, go for it. But that's not going to fix anything. I would not recommend that. Marianne, I have a lot of mucus in my throat and sinuses, anything natural to take. So the first thing is not just how can I take something and get rid of that mucus, but the first thought needs to be, why is your body making this extra mucus? And that's the biggest thing that we're looking at, is the why. You've got to get to this. And that's what all of our doctors here at F8, we look at the underlying root cause, the underlying why. And so why of mucus, look for foods first. I would look at gluten, I would look at dairy, and figure out what exactly is going on with those foods if you're having a reaction. Just in general, gluten and dairy are both mucus producing, but if you have an allergy going on or a sensitivity going on, it's even going to be more inflamed in there. So you're going to be producing more of it. So I would look at foods first and see if you've got anything going on in there. Graves' disease, no one in my family history has ever had a thyroid problem. Took doctors 6 months to diagnose me. Well, I3M3 gain, not sure what that means, but hey there. So Graves' disease is not a thyroid disease. It's not a thyroid problem. Graves' disease is an autoimmune condition causing a hyperthyroid state. And just like Hashimoto's causing a hypothyroid state, but it's not a thyroid disease, it's an autoimmune disease. So I don't care what the end stage damaged tissue is, you have an autoimmune disease. So it could be the same. You could have MS, you could have alopecia where your hair is falling out, you could have lupus, you could have all these different autoimmune conditions, but Graves is just what your body is attacking at this point. So look into dealing with that full autoimmune. I've got tons of videos on YouTube. You can watch and watch and watch all my autoimmune, but it's really adrenals, blood sugar, leaky gut, vitamin D. We're dealing with estrogenic events, infections, environmental toxins, food allergies, all types of different things. Regarding autoimmune and sugar, do we need to cut processed sugar or things like honey as well? Yeah, so here's the deal. With autoimmune, every time that blood sugar spikes up, every time that blood sugar crashes down, you're revving up the immune response and you're destroying more tissue. So cut out processed sugar, sure. Cut out honey, I don't know. Check your blood sugar. Go get a finger prick glucose monitor on our store. Brittany, go ahead and put a link there, f8willstore.com. We've got the finger prick glucose monitors that we like. You can get one of those for 40, 50 bucks, whatever it is. Or if you want to become a patient, we can actually get you a continuous glucose monitor, which is prescription only. You can't just go get that off the street and be able to tell exactly what that is doing. And just had biopsy on left thyroid yesterday due to nodule, had right removed due to cancerous nodule. Morgan, yeah, bummer. We'll see what they say. Hopefully it's not cancerous again. But if they take that out, then you'll probably be on thyroid medication the rest of your life. And you also still, even if you don't have a thyroid anymore, you have to make sure it's converting T4 to T3 like it's supposed to. A lot of different things. Hey, Grace, you have Hashimoto's. Remember, Hashimoto's is not a thyroid disease. Hashimoto's is an autoimmune disease attacking the thyroid. And there's actually two types. You can attack your thyroid or you can attack the bus that transports the thyroid hormone around the body, and it's important to know the difference. A lot of people have one or even both of those, and you've got to know which one is which. So if you're dealing with Hashimoto's, you're dealing with an autoimmune condition, and now you've got to go in depth. You've got to go deep into calming down that immune inflammatory cascade. Get this, guys. So think about this. I had a patient last week. 20 years ago, she got diagnosed with Hashimoto's, but the doctor did nothing besides give her levothyroxine T4 hormone. And what happened was she went and got on that medication, did nothing else. And now we just ran blood work last week. Rheumatoid arthritis showed up. Now she's got this burning, itching sensation all over her body, which is probably autoimmune as well. So the average person, so for you, Grace, you have Hashimoto's, but there's a very good chance that you have multiple autoimmune conditions. You need to also check your ANA, you need to check your rheumatoid factor and see if you have other autoimmune going on. Kay Stapleton, wow, good info, thank you. You are so welcome. Grace cut out gluten for a week, accidentally ate a small amount. Hour later, my ears and neck were hot. Is it related? Yeah, it absolutely could be. Some people, they get a reaction to gluten very quickly, and within an hour or so, it could do that. It's not always a gut thing. A lot of times it's a brain thing. It could be an inflammation thing. So many different systems can get affected by gluten. So again, if you guys haven't already followed us, follow any of the pages you're watching. We're on Facebook, YouTube, TikTok, Instagram, tons of information. We're trying to go live all we can and help you guys start taking massive action in your health and ultimately from the why, from that underlying root cause. F8wellcenters.com is our website. We have offices Fort Collins, Colorado, Denver, Nashville, Tennessee, and we work with patients all over the country, even up in Canada. Let me see what we have over here. What is the best natural supplement for cholesterol? I'm assuming, Lisa, you're trying to lower cholesterol. The first thing you want to look at with cholesterol is stabilizing your blood sugar 85 to 110 all day, every day. I've had very few patients over the years, if we get their blood sugar really stabilized right where we want it to be, that cholesterol does not come down. Yes, there's things like red yeast rice extract and some different things that can be helpful, but I would much rather you fix why that cholesterol is going high than just take something to lower the cholesterol. Cholesterol is actually good. Cholesterol makes all of our hormones, adrenal and male and female hormones, come from cholesterol. It's going to be a big part of our brain. Cholesterol is actually important. We don't want to just lower it just for the heck of it, but if it's going up, it's usually an indication that something else is going on. Marion, thank you and God bless. You are so welcome. Let's see what else we have over here. Got a bunch of questions. So if I missed your question, I'm trying to get through as many as I can. Send me a personal email, drben@f8wellcenters.com. I would love to answer that. Otherwise, you can send us a DM on whatever platform. Can you tell me more about homocysteine of 13, Amber? So homocysteine of 13, homocysteine really is an inflammatory marker for us, and we look at, I like it about 9 or so as the max. Some people say even 7, but 9, I'm not getting too worked up unless it's over that, but usually it tells us that there's some type of inflammatory state, especially in the brain. If somebody's over 15 or 15 and above, the research shows that it's a higher risk of future Alzheimer's or dementia. So it usually comes down when we get blood sugar, inflammatory processes calm down. So you've got to look into that blood sugar side of things. But also, if that doesn't change it, then we look at then we can look at the B12 and folic acid could be part of that as well. So if you guys have not started follow our page, we'd love to keep you up to date. We also have an email series that goes out every week, tons of great topics. Send us your email address and we'll get you on that one as well. No spam, nothing like that. Please recommend something for vitamin D level if it is very low. So this is Ashy 761 Punjaban. I love all your guys' names on TikTok. You guys are funny. So something for vitamin D level if it's really low. So really low, under 30 is really low. 30s is even low. But if you're really low, 3 things you can do. Get outside between 11 and 1. So go out under the sun between 11 and 1 in your bikini. Or if you're a dude, you don't have to wear a bikini, you could probably wear a Speedo. So get outside 11 to 1 every day. Right now, we have 6 inches of snow on the ground and it's about 15 degrees out. Probably not going to get outside today there. Okay, so that's not going to work in the winter. Number 2, you can take vitamin D. So for somebody really low, they might need upwards of 10,000 IU a day of vitamin D. If you're taking that much, you got to double check your blood work every once in a while. And then number 3 is actually go to a tanning bed. And a lot of people are like, oh my gosh, skin cancer. And I'm like, don't go for 40 minutes and get the leather skin lady that you see in Florida. You want to do 5, 10 minutes a couple times a week. And that can be enough to bump up that vitamin D as well. It can also help with some of your seasonal affective disorder as well. Alex, excited for my first appointment with you guys at the end of the month. I know Wilson's temperature syndrome is controversial. What are your thoughts on it, Alex? Yeah, absolutely. It's controversial. Is it? What causes it? Is it a thing? All that stuff. But here's the deal: it almost doesn't matter what somebody thinks about it or whatever, because we don't have a Wilson syndrome protocol. We have what is off in your body, and this is, if you get one thing from listening to me today, think about this: what is off in your body? I had a lady yesterday, Derkums syndrome, which is this weird syndrome where they get lumps all over their body and horrific pain, and they think it might be autoimmune. Nobody really knows at this point, but it's a thing. And I don't know. I've never even worked on somebody with that before, but I know that her blood sugar's off, her liver's not detoxifying, she's got some leaky gut going on, she's got low testosterone, low DHEA, she's not making enough of those hormones, she's got a bunch of these different things going on, and now we're gonna move our feet. Let's go. Let's move our feet and start working step by step. If you're not getting the answers, if you want to look at this, just like Alex, if you want to look at this whole body approach, click that link down below. Schedule that discovery call. Let one of my F8 doctors go through exactly what you have going on. We can do blood work anywhere in the country. We work with LabCorp. So if you're within 30 miles of a LabCorp, we can get that done. Otherwise, if you're out in the middle of nowhere, we can actually drop ship a kit to you and you can get that drawn locally, and we can get that blood work anywhere. So click that down below. I would love to talk to you guys. Desiccated pig thyroid versus synthroid. So this is Tatiana. So desiccated pig thyroid. Sounds kind of weird, right? But it's actually, they take pig thyroid, grind it up, put it into a pill, and now you've got T3 and T4. Synthroid or levothyroxine is just T4. So the pig thyroid, you actually have T3 and T4, and you don't have to convert the T4 to T3, which is a lot of people have a problem with that conversion. So for some people, if their T3 is really low, that they may feel better with that. But I bet some people, they don't feel well on Armour, Nature-Throid, NP Thyroid, any of those. So it just really depends on the person and what they need to do. Have Graves, now lost most of my hair, recommend labs. Yeah, so again, in labs, you need to look at your ferritin levels. Is it high? You've got inflammation, insulin resistance, metabolic syndrome. Is it low? You've got major leaky gut, malabsorption. In the labs, you need to look at your insulin, but do it non-fasting. You have to look at your A1C, see what your blood sugar has been averaging. Look at any of your hormones, your testosterone, is that really low? What are your adrenal hormones, your cortisol and your DHEA doing? You need to look at your liver enzymes, AST, ALT, GGT. You need to look at a full comprehensive panel. There's no magic Graves markers that you look at to fix your body. It's the whole body that you have to fix. Oh, your phone died. So my question was the vitamin D. You may have missed that. 30. So you've got to get outside, get sun, get to a tanning bed, or take external vitamin D. White blood cell count from 6.9 to 10.4. You are in an acute infection. You've got a major infection going on. Gallbladder out for a year, causes more issues, been fighting with shoulder pain since, no help. Stephanie, Brittany's going to put down a link for our well store where we have our supplements for all of our patients, but I let some of you guys jump in there and order some things, and so the GB Flush, Brittany, go ahead and put a link for Stephanie down below, and that could be really, really helpful. What do you recommend eating? Here's what you guys need to do for eating, whether it's for thyroid, whether it's for gut, anything at all. This is what you need to do. Eat foods that stabilize your blood sugar 85 to 110. So write all this down. Stabilize your blood sugar 85 to 110. If it's going up too high or if it's crashing out of that range, you're not eating the right foods. So figure out which are going to do that. Eat foods that are not going to create inflammation. So if you can't get your ring off, if your socks have this big puffy ring around them, when you take them off, anything like that, you're getting more inflammation. If your weight is fluctuating 3, 4, 5 pounds a day, you're getting more inflammation. So you've got to eat in a way that keeps that inflammation down. Number 3 is eating so that digestion is working optimally. What is optimal digestion? Well, you're hungry and you eat. You have to go to the bathroom, you go to the bathroom, but otherwise, no gurgling, gas, bloating, indigestion, heartburn, grumbling, look like you're bloated, pregnant, any of those things, constipated, diarrhea. You need to be going 1 to 3 times a day. Looks like a peeled banana. It's that size and that consistency, so you've got to be doing all those things. If it is not happening, you got to look at what you're eating. That's a big part of it. And then also, what eating in a way that's going to keep you at your ideal body weight. For me, calories don't mean a whole lot. If I eat the way that I eat, I could bump up 500 calories or drop down 500 calories, and I'm not really going to lose any weight because my body's getting the nutrients it needs, gets rid of everything else that it doesn't, and you go from there. So multiple is right. I have RA and psoriatic arthritis as well. Yeah, so that's the thing. So many people, when I do an autoimmune workshop, I have people put down how many they're dealing with and label those. And I mean, it can be 2, 3, 4, 5 different autoimmune conditions. It's crazy. Thank you for telling us about this. I can't take much more of this. I have so many things wrong. Kathy, that my heart just breaks. My mom had to go on disability. She had MS, got a wheelchair, all these things. She was able to heal her MS. She's going to be 80 years old in a couple months and does grading boot camp. I just called this morning on the way to the school with the kids so they could talk to grandma and grandpa, and I go like, what are you guys doing? Oh, we're just working out. She does grading boot camp. They go fishing. Oh, when are you going fishing? Oh, tomorrow. They're going out into the big river, got waders on. They're going to be wading, fly fishing out there, and she's going to be 80 years old. She doesn't have MS anymore. I see this all the time. People can truly heal. So Kathy, send us a direct message. I would love to talk to you or just get on that discovery call. Let's go here. I had Hashimoto's too, Belva. Unless you did a whole lot of stuff, you still have Hashimoto's not had. I have Hashimoto's and lupus. That's very common. Every patient that we have come in, we look at their ANA. ANA is going to tell us about lupus, Sjogren's, mixed connective tissue, all types of different things. So again, guys, if you need help, if you've got these things going on and you're not getting the results, I would love to talk to you. Click that link down below, schedule the discovery call, and let's talk about what you have going on. Shannon, we've got, what do you recommend for adrenal dysfunction? First thing for adrenal dysfunction is to stop whipping the adrenals so hard, stop damaging the adrenals. Number one stressor to the adrenal glands is blood sugar swings, especially the dips. So if you've got blood sugar swinging and crashing down, hypoglycemia, you're stressing out your adrenals. That's number one. Number two is to get a brain map and see what your brain map is showing and do neurofeedback if necessary. The vast majority of people with adrenal dysfunction or adrenal fatigue, their brain is going non-stop. And so it absolutely, we've got to calm that down. Number three, relaxation techniques, calming, prayers, meditation, breathing exercises, all of those things. And then you can start taking some adrenal support. And we've got a bunch of things that we do, but you've got to get to the why. Is EPA and DHA good for cholesterol? And if allergic to salmon, can I take it? It depends on, some of them come from, this is Tom, some of that EPA, DHA comes from, sardines. There's other sources. It's not all from salmon. And really, you want to look at a higher dose EPA. If it's more about cholesterol and cardiovascular disease, you want to go with more EPA. And if it's more for brain function, you want to get something higher in DHA. So again, thanks guys for everybody jumping on. Go ahead and follow us. Tons of great information that we are getting out. My husband is 38, his test level is 329. His doctor says it's normal. Is that a good level? Testosterone of 329 is not a good level for 38 or 48 or 58. 329 is not good. Here's the deal. Get this, guys. Testosterone levels have dropped in half over the last 50 years. So testosterone levels in men, as well as sperm count in men, is 50% of what it was 50 years ago. So literally, men are not the men they used to be. And a man at 38 years old and a testosterone of 329, he does not feel like the man that his dad did. And you can get into whole gender identity and all these things, but this is reality. Physiologically, he's going to feel more feminine than his dad did, than his grandpa did, than his great grandpa that was out on the farm doing all these things. Absolutely 100%. So 329 is not good. Testosterone low in men 99% of the time is because the men are converting their testosterone over into estrogen, and that is primarily because of insulin resistance, metabolic syndrome, prediabetes, blood sugar issues. Guys start getting man boobs, they start lactating, getting hot flashes. I mean, crazy things can happen. And so then a guy goes and gets on testosterone, like, hey, I got up to 1200 on my testosterone, but now that is even spilling more into estrogen. So here's the deal, Amber. I guarantee you, if he's only down at 329, his blood sugar is not right. You need to check his estrogens and see what those are doing, and you can see massive improvement by getting that blood sugar stabilized. But do not just go onto testosterone replacement. Opinion on eggs. I love eggs. I eat multiple eggs a day. We have chickens. I heard eggs are very expensive nowadays. So if you're having issues getting eggs, I'm sorry about that. We get like 13 a day at our house. So if you're okay with eggs, you should be eating eggs. It's a great nutrient source. It's got a lot of fat, a lot of good protein, a lot of good things. A lot of our patients, especially in the early stages, they find they have a sensitivity to eggs. So they're great unless they're not. So Miss Star Ruby Yahoo, please send me a link to set an appointment. Yeah, so it is right below. So Brittany, put that in the comments down below, or there's a link tree in my bio, and you can set that discovery call. And how much does a visit with labs cost? So normally that blood work is it's 200 something. I don't know. Brittany, if you want to put that cost down, the exact cost there, and that includes all the hormones, all the thyroid, Hashimoto's, lupus, rheumatoid arthritis, uric acid for gout, fatty liver, all these different things. It normally $2,000 to $3,000 if you just walk in off the street, but we've got cash prices set up, and we're able to get it down that much. And then anybody watching, if you guys want to jump on and schedule that discovery call, I'll give you guys a special today, 127 for the visit with the doctor, going over all the history, everything, and then reviewing that blood work as well. It's a questionnaire, about 150 different questions, take you over an hour. And then if you can get into one of the offices in Colorado or Tennessee, we'll even do a brain map in there. So just tell them when you do that discovery call, tell them that Dr. Ben threw out a special that I didn't tell anybody about ahead of time. So we'll do that at 127. And then that blood work, if you're coming into the office, we'll do it in office. If not, we'll do that anywhere else. Where to start with healing autoimmune caused by COVID? Yeah, Anna, this is the same thing that we think about, whether it was caused by anything. So things that can cause autoimmune: adrenals, blood sugar, environmental toxins, infections like COVID, Epstein-Barr virus. It could be that you just reactivated your Epstein-Barr virus, and that's what's causing this to happen. So it's the same thought process. You've got to do an in-depth blood panel. Your doctor is not going to know what to do. All they're going to do is put you on prednisone, put you on Humira, $12,000 a month, put you on methotrexate, low-dose chemo, and your hair starts coming out. You're going to start having all of these issues just because you're taking these autoimmune drugs. You're not going to fix anything. So if you truly want to get to where to start, click that link down below, schedule that discovery call. One of my FA doctors around the country will work with you. If you can get into one of the offices, great. If not, yeah. How to support your thyroid before problems. Denica, Michelle. So here's the deal: how to support your thyroid. Number one, make sure you don't get an autoimmune condition, because that's the number one cause of low thyroid issues is Hashimoto's. It's autoimmune. Number two, you want to look at maybe even taking some iodine, some selenium. If everybody in your family has low thyroid, you need to be taking some of those supports. But number one thing you can do is not get an autoimmune disease. I'm on a plant-based diet, no meds for RA and psoriatic arthritis, seems to work for no pain. Would you recommend this? The thing that I would not recommend is any diet that does not stabilize the blood sugar 85 to 110 every day. So if your diet is making your blood sugar go over 110, you're revving up that immune system and you're destroying more tissue. So plant-based diets, and I don't know why they changed that name, but they're vegetarian diets, vegan diets, whatever it is, are very, very hard to keep that blood sugar stabilized. We've checked thousands and thousands of patients on their CGM, on their blood sugar monitoring, and a vegetarian diet is very hard to keep stabilized. So that's what I would look at. Day 19, protein, vegetables, fruit. Is 30 days enough? What best to start adding? Ann, that's great. Go 30 days. That'll be great. And then you start adding in certain things like, okay, let's try some corn, or let's try some dairy, or different things like that, and look for issues. Let's see. Do you have experience in helping people with nasal polyps? It's going to be looking at that inflammatory process. Sadie, we would have to dig deep into there. Ashley Bundle, thanks. You are so welcome. And okay, I'm fatigued all the time. My thyroid is not right, and I'm on medication now, but white blood cell count is bad. This is Kathy. So here's the deal. You've got to look into Hashimoto's. If you didn't say anything about Hashimoto's there, you probably have autoimmune, and so just taking thyroid medication won't fix it. White blood cell count is bad. If it's low, it's probably a chronic Epstein-Barr virus. If it's high, you've got some kind of an acute virus there. Sheriff the Chocolate. Come to Cancun. That'd be fun. Get out of the cold for a little bit. Um, Thank you. This is Amber. I'm about to start with Dr. Sherry. My glucose was 62 with the labs she did after food and coffee. Amber, Dr. Sherry is amazing. I think of all of our FA doctors, she has the biggest heart for helping people heal. She is just amazing. But get that, guys. Amber said her glucose was 62. I don't like it lower than 85 or 110 on the high spot. And so get that. She was 62 in the middle of the day, crashing down, adrenals revving up, her body going into this inflammatory state, probably stimulating some autoimmune. Hey there in Ohio, good to see you. How much for blood work? It's like 275, 290, something like that. Do you take teens? We live in Florida. Absolutely. I always say this, we see just as many teenagers and 20-something-year-olds as we do 50 and 60-year-olds. It's crazy. The age doesn't matter anymore. Is it true there's no help for tinnitus besides hearing aids? Nicole, I would look into liver detoxification, clearing that out, getting that liver working as well as possible. That is one thing that you can look into. Yep, Kay Stapleton, I'll make you an appointment soon. Awesome, love to talk to you. Yep, if it wasn't so expensive to get help for all these autoimmune conditions, I wouldn't be sick. So here's the deal. It's really, really sad because health insurance, Medicaid, Medicare, whatever, they'll pay $12,000 a month for Humira. They'll go and put you on prednisone and do surgeries and all of these things, spend literally hundreds of thousands of dollars a year, but they will not pay pennies on the dollar of what it costs for us to actually get somebody's body to heal. And that is the amazing part. That's what I want you guys to think about. And as you're sitting there going through, okay, what am I going to need to do? How am I going to get my body better? My digestion, my autoimmune, my kids, my husband, anybody, any loved ones, anybody you know. What do you need to do? You need to get to the underlying root cause. And that is the biggest thing that I want you guys to think about as we finish up today, is that there are reasons why you have autoimmune. Yes, it's going to take some time. It's going to take some energy. You had to do something to get your body into that state. And most people with autoimmune conditions, it was somewhat self-induced, whether that was diet, whether that was environmental toxins, whether that was even having babies, estrogenic events, all these different things. And now you've got to reverse that. And so you're going to have to put some time, you're going to have to put some energy, some finances into that to truly get it better, because taking prednisone, going to your doctor, going on the meds, all those things will never fix it. And if you just want to cover up the symptoms, great. If you just want to take HCG, if you just want to take Mounjaro or Ozempic or whatever and lose a little bit of weight, great, go do that. Because if that's all you want to do, you really don't want to work with me anyways or any of my FA doctors. You just want to take a pill and get some change. But if you truly want to make a difference in your life, in your family's life, in your kids' life, whoever has the issues, then take a step back, really figure out that root cause. Click that link down below, schedule that discovery call. Let's run the in-depth blood work no matter where you live. If you can get in the office, is great. If you can't, let's run it remotely and figure out exactly what's going on. When you schedule that discovery call and you talk to my new patient coordinator, let them know that it's $127 that special that I'm doing today just for you guys for being on for this live Q&A. Love seeing you guys. Let them know that, and then let's get cranking. Let's get you your life back and not just cover up symptoms. If you're a symptom cover up kind of person, we're not the place for you. If you're I'm tired of this and I truly want to fix the next 30, 40, 50, 60 years of your life, you want it to be legit and have energy and function. And, like me, I get up in the morning at 5 o'clock, I got energy, I get cranking, I go, 8, 9 o'clock at night. You know what? I'm getting ready for bed. And my wife's like, okay, don't have in-depth conversations with him after 9 o'clock. But it's been those 16 hours of being awake and rocking and this same energy I have now. I guarantee you at 6 o'clock at night, I'm still going to have that same energy. because my blood sugar is steady, because my body, I know what to do, I know my digestion, I know all these different things, and you can have that energy, you can have that function, you can have that ability to be the best you possible. So love you guys. If I did not get to your question, Dr. Ben at f8wellcenters.com. Send me an email. You can DM us on TikTok, Instagram, Facebook, YouTube, any channel. We are out there. We love talking to you guys. Motivation. You've got to get up and go. You've got to move your feet. There is no amount of drug, no amount of surgery that's going to fix you, not even any certain amount of supplement. A lot of you guys were asking, what's the best supplement for this? There's not even a supplement. I go through supplements every day with patients, but that's not the solution. Your body, your insides, your healing potential is the solution. All right, take care. Stay strong, everybody.